Hello everyone. Today's video is a Q&A video talking about methylene blue, talking about high-dose sulfur therapy, talking about serrapeptase, tocotrienols, and oh my goodness, alternatives to soy lecithin products if one is sensitive to soy. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So, bunch of questions, just rapid fire here. First one is, can methylene blue cause psychosis in bipolar with psychotic features? And liver is disgusting, by the way. So thank you for that little tidbit. I must have said something about liver in the video, or maybe it was just a random, hatred for liver. That's fair enough, but it is pretty gross. That being said, you produce a nice, or prepare a nice pate, and it can be really, really quite delicious. Liverwurst, one of my favorites, although I grew up eating it, so that might be why. Anyways, I have to date not prescribed methylene blue to a patient with bipolar, so I cannot speak to that from firsthand clinical experience. With that being said, kind of thinking about it, just putting on my thinking cap, just academic exercise here, just for fun. So what do we know about methylene blue? We know that methylene blue seems to have this fairly mild monoamine oxidase inhibiting activity, so it can inhibit the breakdown of serotonin, so there's going to be more serotonin kicking around. What is more serotonin potentially going to do? It's potentially going to elevate a person's mood. It's going to make them feel just kind of happier, make them feel more buoyant, just feeling better overall. And so it is possible that if one boosted up serotonin too much, then it could potentially push a patient into more of a manic episode and maybe contribute to some psychosis. But my guess would be probably not, and that it would really be more if it was having an impact on boosting up dopamine levels in a more sort of significant way that would be more likely to be contributing to psychosis symptoms. So I've only treated worked with a handful of patients over the years with a bipolar diagnosis, just not something that I focus on in my practice. So yeah, I would definitely talk to one's healthcare provider before working with methylene blue. If I had a patient with a bipolar diagnosis, I would definitely, bring in some expert opinion on someone who knew about that specifically, but just thought I'd talk about that academically because I thought it would be fun. Thank you for the question. Next one is, can you review serrapeptase / serapeptase, kind of tomato, and tocotrienols? So I'd be happy to talk about those things. Interesting that they're being asked about together. They don't really go hand in hand too often. Although every once in a while they do. Serapeptase or serrapeptase is a proteolytic enzyme derived from, I think, silkworms, if I'm not mistaken. And these proteolytic enzymes, when taken away from food, seem to be helpful to reduce inflammation, reduce hypercoagulability, and can potentially maybe break down like adhesions and different things like that in the body, is what is talked about. I'm not sure if that's actually ever been fact checked, but that is a reason that people take them sometimes. I have found that serrapeptase is helpful in some cases. To be perfectly frank, I've had lots of patients who took it and didn't really see much of a difference, and then I have seen it help quite a few patients. So I'd say it's about 50-50 odds in terms of it helping. So definitely not like a slam dunk every time, but it's been helpful for folks over time. I've used it in patients with autoimmune conditions, patients with long COVID. I've used it with patients who are just kind of suffering from like general inflammation, and we aren't really exactly sure where it's coming from. Patients with polymyalgia rheumatica, and sometimes helps, sometimes doesn't. But that's been my experience with also patients who have DVTs, deep vein thromboses, that are not able to have them removed or like surgically operated on, or it's just kind of a wait and watch kind of thing. So we've used it in those conditions, and sometimes it's been really helpful in those cases. A couple of cases where it just really hasn't moved the needle in those cases. So I think it's a useful supplement. If there's more specific questions, I'm happy to talk about it. Tocotrienols. So tocotrienols are There are 4 different types of tocotrienols, alpha, delta, gamma, and beta, I think. And they are part of the vitamin E family. So there's 4 tocotrienols, 4 tocopherols, and together they make up the vitamin E family. Tocotrienols are something I prescribe all the time. It's one of the ingredients in my mitochondrial support formula, or the one that I had formulated. And I think vitamin E is wonderful, very important for redox, balancing in the body. Vitamin E, it's the family of vitamin E molecules, to my understanding, is the most potent fat-soluble antioxidant that we have in the body. So very, very important for our cell membrane health and integrity, mitochondrial membrane health and integrity, fats of all shapes and sizes. We want to make sure we have vitamin E kicking around. In terms of a kind of therapeutic agent, I mostly use vitamin E is part of the mitochondrial support because it's part of what the mitochondria need to function properly to keep them as healthy as possible. And then I also use vitamin E when patients are, when we do testing showing that patients have low antioxidant status overall. So we'll usually get them on glutathione and vitamin E. So that way we're covering the most potent water-soluble antioxidant, i.e. glutathione, and the most potent water-soluble antioxidant, vitamin E, fat-soluble antioxidant, vitamin E. And then vitamin C is important as well because it kind of acts as a go-between between those antioxidants, to my understanding. So mitochondrial support formula has vitamin E and vitamin C in it, and then sometimes we'll throw glutathione into the mix as well when we're supporting the mitochondria. So I'll leave it there for now on those. Any follow-up questions on those topics, I'm happy to chat about it further. Next one is, so I had posted a video about using high quality, or what they sometimes call pharmaceutical grade phospholipid formulas, and I must have mentioned that, or maybe I didn't, but anyways, a lot of them are soy based. So the question is, would sunflower lecithin work instead? So there are these quote unquote pharmaceutical grade phospholipid formulas that you can get that are sunflower based. There's a company called, oh my gosh, what are they called? Nutrasal, Nutrasal. My understanding is they're the parent company that supplies a lot of the other companies that make these really high quality phospholipid formulas, and so they do have a sunflower version. So for my patients who can't tolerate soy, then we'll usually go with that particular company. We usually use a company called Body Bio, and they have a soy-based one, and I understand that they source from Nutrasal, is my understanding of it at least, and it's a great product, and it's just less expensive to get it from Body Bio than from the parent company, somewhat ironically, so we get it from them. So it's a really great product in my experience and helps a lot of patients. The next one here is about methylene blue. I'm taking 300 milligrams of 5-HTP, which is a serotonin precursor. I want to start methylene blue. Should I stop 5-HTP for a couple of weeks before starting? I'm looking to take it for Hashimoto's, brain fog, chronic fatigue, and Asperger's syndrome to see if it helps. So of course I can't give any advice over social media, so can't advise on this specifically. What I can say is that with 5-HTP, if I had a patient who was on a robust dose of 5-HTP and they wanted to start taking methylene blue, and it seemed like it would be okay for them to come off that 5-HTP, I usually treat 5-HTP like I treat any SSRI medication that boosts up serotonin, giving it kind of a good 6-week washout period just to be on the safe side. I honestly don't know if that's being overly cautious, but I haven't seen any research literature kind of telling me exactly how to treat 5-HTP in terms of how long it takes to wash out of a system. It seems to behave pretty similarly clinically to SSRIs, so that's kind of the rule that I go by with my patients, just as a point of interest. And then the very last one here is, says I posted a interview with Dr. Kathleen Janelle about high-dose sulfur therapy. Please check that out if you haven't heard about that, or keyword search MSM or sulfur on my YouTube channel to see those videos. Very, very cool therapy, something that's been helping so many of my patients. And so the comment was, I'm more confused than ever about the use of sulfur, Janelle versus Greg, Yelp. So I had another video interview with a brilliant ND, an antibiotic doctor named Greg Nye. I don't think we really talked about sulfur that much, but he talks about it in other has talked about it at other times, written articles about this, where he actually puts patients on a low sulfur diet and sees therapeutic benefits from that, especially with hydrogen sulfide gas producing SIBO. The punchline is that I talked to him about this a little bit during our interview, and he was like, "Oh, that's interesting." And apparently, him and Dr. Janelle know each other, and maybe they were going to have a chat about it. But I can definitely vouch for high-dose sulfur therapy. Really don't have much experience with a low-sulfur diet, but Dr. Nye is a very smart cookie. I'm going to leave it there for now. Any questions or comments, just post in the comment section below.